So why Germany? I think why COVID is probably not the question. It's really more why Germany. I think if you go across the globe and follow what is happening in the different countries in terms of infections, in terms of hospitalizations, in terms of healthcare, but also around that, I think a lot of times Germany is basically mentioned as one of the core countries where maybe the policies are also working, besides maybe other countries like Israel and South Korea. That's also what you see, for example, in different media. That is basically now the press, but you can also see that in different television shows and television news there. For example, Germany response to the COVID-19 crisis puts the UK to shame. Why is that? We might have one or the other points in there, but also I think maybe important, Germany offers cash for everyone. We'll not touch base on that tonight, but it has obviously already, or is giving already a good hint towards what we are interested for tonight. So tonight is really the economic question, which is driving us for the analysis. And we would even narrow it down that we would analyze and try to give you some answers. How much did the German healthcare cost, or how high were the German healthcare costs so far in the first 100 days since the outbreak end of January 2020 in Germany? So what did we do? What we have done is we have combined two different parts in here. I think one is we have utilized the information and the development of a simulation tool with the so-called COVID sim, which was developed by epidemiological experts out of the University of Tübingen. That was actually done by Professor Eichner and Dr. Schwem, with whom we also work already together since many years. That simulator is also being used, for example, by the Baden-Württemberg government, but also by now just recently as well, by the German government in the development and the decisions as well in terms of policies. So the simulation is one part of that, and we'll see a couple of those kind of results in a couple of minutes. And we have then combined the results out there, the epidemiological kind of results, with the costs which happened then in Germany. Before coming to the results, and then obviously, and I hope to a bit of a discussion as well, some definitions up front. What you might have seen already as well in the last couple of days and weeks is the so-called R0, which is the baseline reproduction number. The baseline reproduction number is a steady number, so it's fixed for disease, but you can obviously adjust that based on the policies, meaning that the effective reproduction numbers might be different dependent on the dependent on the different kind of health policies. For the SARS-CoV-2, I think the effective R is currently probably under 1 in Germany, might be again around 1 or maybe above, based on the news we have maybe as well just seen for today. I think that the baseline reproduction number was probably around 6 at the very early beginnings, and then obviously the fixed one, so we will see which kind of impact that might have had in the last couple of weeks. I think generally, and we see that as well, because we have as well mimicked just one wave, one further infection wave across 2020 is also, I think, this quite clear, and I think not only the COVID sim model, but also other modeling teams have shown that in case of no measures, of no control measures, or no policies which were put into place in the last couple of weeks, the exponential kind of curve would have already peaked probably already in spring, the latest in early summer 2020 in Germany, but also obviously across other countries. So some assumptions as well in here. We have included a contact reduction which was implemented in Germany in March, which obviously had an impact on the effective reproduction number. So you have seen that And that's basically what I told you as well a couple of minutes ago. I think it clearly went down from around 6 to around 2 to 3. And I think now we are probably around a number of 1 or maybe below 1. Below 1 is obviously the kind of aim, always the aim. I think that's also what different institutions are clearly stating, as obviously then one person is infecting less than one additional person, which is obviously then giving a good kind of hint towards an effective kind of policy for COVID-19. So for everybody outside of Germany, I think it's also important to maybe give quickly a kind of introduction what we're speaking about in terms of the size of Germany and the kind of environment, let's say. Germany has a population of roughly 83 million people and has overall 105 statutory health insurances, which cover around 90% of the market. Additionally, we have around 45 private health insurances, and for some special groups, for some special populations, let's say, there are some clearly defined kind of measures, which is especially on income, so has nothing to do like in other jurisdictions in terms of health. The assumption for the simulation you now just see is that we have used an effective R of 2. We have used a contact reduction time of 77 days, which we thought is quite realistic for Germany. We've just taken the number of days when it was basically taken into the effective day, which was mid of March, until the current kind of estimation, which would be the end time of the pupil. So whenever people or kids could go back to school, which is currently anticipated in June. Other assumptions, and we have these here internally, are aligned with the Robert Koch Institute, the leading institute, which is also obviously supporting the German government and also the German Society for Epidemiology. We will not go through all of those input values, as I think that would take probably too much time. So we'll just give you one snapshot for one scenario in order just to see how much of cost could have been potentially raised in the last roughly 100 days. So directly jumping into the results. So what you see here is the scenario analysis of the COVID sim until today. I think you see quite clearly. I mean, we have roughly 150,000 infections, which I think is quite similar to the numbers you can see or you maybe have seen tonight in the news. So we have a couple of further informations down there in terms of sick medical consultations, hospitalizations, ICUs, and deaths as well. But I think overall, it basically shows that the numbers are confirmed basically to what have happened so far. So why should we maybe as well care now? I think especially if we've spoken about the R of 0, I think one of the leading epidemiologists, Professor Trosten from the Charité in Berlin, has just warned, I think yesterday and again today, about the current kind of, let's say, more relaxing policies which have been in effect since Monday this week. I think what he more or less said is we might lose the advantage we have worked on until the ease of the lockdown. What does that mean at the end of the day? We've also had a look, and that's why we thought let's put in, because of that kind of discussion now, that kind of scenario as well in the simulation tool. So what you see here is in the gray box over there from day 50 to around day 120, 125, the gray box is basically the lockdown of the society with different kind of measures. If you would basically open that up again, which we thought and assumed now just by around beginning of June timelines, the number of infections would basically, I think we could say, explode, because you see here the infections would be until July 25th, around 20 million people. Out of 83 million, 20 million would be infected. We would have basically around 909,000 dead people, and as well as a significant number of hospitalizations and ICUs as well. Just to say the kind of measures are important, and I think it's also very important to follow still the kind of rules which have been given, and maybe might even be again, coming a bit back, not so much relaxed as we have it now in the near future. You see here the peak hospitalizations would slightly follow roughly a week later after the end of July, around 1st of August, with roughly 500,000 hospitalizations. And I think maybe even more important, the kind of quite famous ICU beds which would be needed, which are around 100,000, which are clearly above the kind of sources even in Germany we would have. I think currently we have around 31,000 ICU beds, which is already a very high number. I think as far as we know, the highest number per country across the world. If we take maybe let's say the US and Russia maybe out, or calculate it back in proportion to the population, what we have. So coming back to the question we had, because I think that is more kind of epidemiological kind of scenarios and what could happen and different kind of things. We have as well model different kind of waves and different kind of policy impacts across the time. But I think the ultimate kind of core question, that is why we maybe nailed it down now to the first 100 days since the outbreak for the healthcare system only. So in the first 100 days, which is a bit more than where we are currently, is 100 days are basically now at May 7th. So is a bit, what is it now, 2 weeks from now, I think roughly, we would probably end up with 288,000 infections, which I think is still quite realistic. And with a different kind of hospitalizations and as well ICUs at the upper end. I think with those numbers, I think we have now roughly 150, 160,000 infections and with roughly 20,000 ICU beds covered. So I think we have still a bit of room, and I think with that number, we could probably still deal in the German healthcare system. We're not speaking now about the medical kind of impact. I think what we're now interested is in the economics of that. So we have obviously combined all of those different results. They are still all deterministic, that we can easily as well interpret it and then maybe as well discuss it. So what you see basically is for the first 100 days, the results will be, or let's say, ending up in roughly 10,000 non-ICU utilization, so roughly 10,000 hospitalization cases. And if we take a look at the DRG values, which could be taken for Germany, the cost per case would be around 5,500 euros, which would be ending up in already just for the first 100 days, dependent also on the length of stay, but we have assumed here the average length of stay for the DRG, which was just created for the COVID-19 cases. So we're ending up with roughly 60 million euros of costs. Those patients would not need an ICU, just a kind of normal ward in a hospital. So the ICU beds would be around 2,800. So you see that this should be quite well be handled also for the first 100 days. 7 days of ventilation is very impactful, obviously, for the patients. And the overall cost is per patient 14,000 euros, which would then end up with those number of ICU cases with an additional 40 million euros of cost. So overall, just the cost for the first 100 days in Germany would end up with roughly 100 million euros for the healthcare system. That's just for hospital cost. What else? There were additional ventilators obviously needed because of the additional ICU beds as well. There were roughly 10,000 additional ventilators being bought by different kind of stakeholders in the German healthcare system, and obviously different and diverse kind of models were being bought. The cost for those basically range between 20,000 euros and up to 150,000 euros per ventilator. We have used here as an assumption on average that those or that a ventilator would cost 50,000 euros, which would obviously then end up in an additional 500 million euros of cost for the German healthcare system. Additionally, I just mentioned, there are also additional ICU beds. We have created in Germany an additional 12,000 ICU beds in the last 6 weeks. And per bed, the healthcare system basically paid another, obviously, 50,000 euros to create that, just because obviously you need the kind of equipment for an ICU. I think there are clear standards which need to be met. So 50,000 euros for another 12,000 ICU beds, which are another 600 million euros just in the last 6 or 7 weeks, which were created. Furthermore, I think, to be honest, I think it was a good, and I think it is a good kind of policy which was also implemented there. For each free hospital bed in a normal ward, for example, but also in ICUs, so in general, each hospital is receiving 560 euros per bed per day, so per free bed per day, in order to have enough resources basically for a potential infection wave. I think we went through the first one. It's now the question, just think back what I have just said 5 minutes ago, which might, hopefully not, but might happen later this year. I think then it's really important that we have enough beds available. That costs obviously 560 euros for an addition for the currently 250,000 free beds across Germany. Just keep in mind, we have some hotspots around Germany, which are more in the south of Germany, Bavaria, Baden-Württemberg, but also in North Rhine-Westphalia, and less cases, for example, in the east of Germany. But if you calculate that back, you are ending up already with 14 billion euros just for the first 100 days, again, of costs for the healthcare system. Furthermore, what everybody can read as well in the newspapers every day, the big discussions on the tests and which kind of tests to be used, etc. Currently, the only available test is being reimbursed in Germany with 59 euros per test. So we are currently doing around 100,000 tests per day across Germany. So if you calculate that as well, for each of those, let's say, times in the model as well, you would as well end up in another 590 million euros of cost just to provide and do the tests, obviously, to as well have a good diagnostic across the country. Finally, for the analysis we have so far, there was also an additional, or there is an additional kind of fee which is being paid to each hospital for the protection equipment. So for each patient, an additional 50 euros of protection equipment is being paid for. And if we take the roughly 13, or let's say roughly 14,000 patients in here, which we have seen the first 100 days for the different kind of time points, obviously, we would add up again another quite low number if you see those other numbers, but it's another 659,000 euros. Adding up various things, it was more the idea to show you the individual kind of cost items. You see already some drivers there, and ultimately everything is adding up to roughly 16 billion euros, which the COVID-19 outbreak cost the German just healthcare system, and the focus on the inpatient healthcare system in the first 100 days. As a kind of caveat, obviously, we have not yet included any costs in the outpatient setting, any additional kind of visits to physicians, to GPs, for example, what some patients or just generally some parts of the population have as well done because of the fear of an infection have just cost there. As a kind of conclusion, I think the COVID-19 outbreak, and you have just seen the numbers here, will have a significant impact on healthcare budgets, also and especially in the long run. Just imagine that kind of wave might really come back, as we have just seen roughly 10 minutes ago, or just we might have different kind of waves with different kind of further kind of investment in the various areas of the healthcare system, maybe also in the outpatient setting. I think that's quite clear. Overall, The cost for the first 100 days, what we have calculated based on the simulation tool COVID Sim, was around, just to set that a bit with this, is around healthcare, but so much at the end of the day, but it's still obviously a very significant part. And especially keep in mind that this is not the only spending of the government and of the German system in general. I think there are also a lot of social support programs which are currently adding up. The numbers we have read in the last couple of days are estimations around 1.2 trillion euros just for the next couple of probably 2 or 3 years. Then obviously the healthcare costs are maybe not that significant, but I think is a very important part, obviously, from a medical perspective for every patient. And I think it's just good to see which kind of costs are being created, and also just to see and to plan as well for the future what might happen in the next couple of weeks, months, and years. I think that was it basically from my side. So Lutz, I think if you want, we can also add up and open up the kind of floor for questions and comments.
Thank you, Stefan, for this wonderful presentation. I think these are a tremendous number. And remember, as you said that on the last slide, we just focused on the inpatient setting. So there are like many more costs for all the servicemen who need protection gear, for ambulance helicopters who now have to be equipped with special gear, and so on and so on. Yes. We have a question here from a member of the webinar, and he's asking, well, looking at these tremendous numbers now coming up, what might be the short, mid, and long-term consequences on the pharmaceutical or on the medtech market, Stefan?
I mean, obviously, actually a very good question. We had that as well in the last couple of days, also with not only with clients, but I think also with stakeholders within the system. I think it might have obviously a different kind of impact. I think, first of all, I think in a short-term perspective, I think for companies which might be providing obviously solution to the COVID-19 crisis, I think this is obviously a big kind of opportunity, because I think at the end of the day, those parts, those opportunity solutions are really needed. And I think it is also seen that in such a crisis, I think the money might just as well be flowing, right? Additionally, I would say for companies who are providing, let's say, solutions, not directly to COVID-19, but maybe solutions which, for example, reduce infections, might also have a good kind of opportunity, not only in the short term, but probably also in the mid and long term run, because I think everybody will probably remember that kind of situation for a longer time period. Ultimately, and I think that's maybe also where the question might be, or maybe was more reflected towards, when we think about the potential price negotiations and negotiations around budget and for also for hospitals maybe, but especially obviously for the pharmaceutical and diagnostics kind of environment, this might, I guess, have a more kind of negative impact at the end of the day, because I think once I think the crisis is over, even if it might take maybe another year or so, I think the budget might be further tightened, I think, especially maybe with that respect. If the budgets might still be, let's say, a bit more relaxed from a hospital perspective, or for equipments, for example, what politicians are currently raising, I think needs to be seen from my perspective. I think politics is a lot of times more oriented in the short term, right? But I think from a pricing perspective, I think that's probably something which would be needed and need to be taken as well into account when planning for launch of future products. And maybe just last note here as well, I think also important here, just to remind again everybody, this is not a German specific problem, obviously, but it is a global problem. So it's also the question where the countries are at the end of the day in terms of financial strength. And I think also, to be quite clear now, I think Germany might be one of the few, I guess, countries where there's still some financial stability, even within that kind of situation. So Yes, it might be getting more tricky and more hard to negotiate, but I think there might still be some kind of budget available for also further innovation in the future.
Thank you. Okay, we have another participant asking if you could explain a little bit about the test you mentioned there, which is reimbursed to 59 euros. What kind of test it is? Is it a quick test or is it a lab-based test?
Yeah, also a good question. I mean, currently it is a PCR based test, which is being done in laboratories. It's also only done in some very few special laboratories. And I think ultimately that's maybe also an interesting part. Obviously, it takes quite still some time to get the results. I think the number I have in mind, maybe Lutz, you have some other numbers as well in mind, but I think patients normally need to wait at least around 2 days before they get the results. I mean, sometimes even longer. I think could even add up to sometimes 5 or 6 days until they have the results of the test.
Yeah, especially in the rural countries. I mean, you have to collect the test, you have to drive the test. Here in Tübingen, the tests are driven over the countryside. One lab is now in Frankfurt. So, you know, it's still 200 kilometers there, just on the road. And that's also, you have to calculate. Yeah, it's a lot of effort they put there. Okay. We have another question. Michael is asking, do you have any idea about the opportunity cost to the hospitals? A free bed is reimbursed with 560 euros, which is often lower than another case could be invoiced. And how much compensation is offered to the hospitals to compensate the loss, which, you know, is coming, which is the loss which is created by the system? And how does the cost develop if we keep our 0 at 1, which was obviously the case even before Germany went to the lockdown?
Yeah, I mean, it's a good point. I think at the end of the day, I think it is obviously important just to say 560 euros for a free bed per day might be obviously less than what a hospital, for example, would potentially get if they might have a patient in there. I mean, at the end of the day, I think there was also a lot of political pressure, obviously, behind in order to have not only free beds, but also additional kind of beds available. So I think that was also maybe a kind of a point maybe to mention there. I mean, at the end of the day, you might be right if they would, instead of having a free bed, the patients for various kind of disease areas in there, they might potentially have a further revenue. But I think ultimately it might be maybe worthwhile to even dig a bit deeper in there for some analysis, because obviously we also know that most of the times with the DRG values, which might be obviously higher than the 560 euros, but there's normally not a kind of, let's say, a monetary benefit for the hospitals of the amount for the DRG. I think the 560 euros for a free bed is more or less, I would say, the monetary benefit for the hospital. So I think, I don't want to say that there are any money with it, because I think there is maybe a reason behind, obviously. I mean, we see what might have happened also to Germany if we just look over to Italy or to Spain or to some parts of the US. But it's maybe worthwhile to have a further deeper look in there.
Thank you. And another question is coming in. It asks, while this model accounts for hospital-related costs, do you think this model can be adapted to account for the costs of folks in home isolation?
Absolutely. The model is very flexible. So it's we have just really taken out for tonight a very specific part, which was the inpatient setting, right? I mean, there are also opportunities in the model to get the number of patient, or let's say the proportion of the population which is basically at home isolation. So that's also important, has then also obviously an impact on the infection rate. So yes, that model is very flexible and it can be used for various settings, for the home-based, for the outpatient setting as well, obviously, and also for example, in the outpatient setting, there's also the opportunity to analyze how many patients would really seek, for example, medical support with the GPs or other physicians, but then also the same, obviously, with the hospitalization, with the ICU beds. So yes, that is possible.
Okay, and additional to that adaptation of the model, there's another nice question coming in. What could be the impact of a possible vaccine to the infection rate? Did you consider that in any simulation?
Yeah, I mean, I think especially since yesterday, since the Paul-Ehrlich Institute has, I think, made clear that a first vaccination trial is being conducted or has at least been started in Germany. That is obviously a very valid kind of question. We haven't really taken into account that for this scenario we have presented in here, but obviously vaccination would have a big kind of impact on the immunity in the population. So the infection rate would most likely significantly go down and would obviously then have a much bigger impact than any of the other kind of health policies which are currently being put into place.
Thank you. Okay, and here maybe the last question. You still have the chance to ask for more questions if you want to. So the question we have now is a more broader question to all that COVID-19 situation now. To which extent does COVID-19 pushes digital health solutions in Germany? Any updates on that or any remarks?
Yeah, I mean, it's probably two things here, right? I mean, the German, well, let's say there was a new law which was put into effect January 1st for, let's say, digital apps in healthcare in Germany, January this year, which allows basically as well to get regular reimbursement for health apps with evidence, obviously. And there was a special system as well just put into place, let's say a bit similar to AMNOG, but I think that's a number one, I think, generally for digital health. I think the question, however, is probably more linked to the discussion we generally had, for example, with, let's say, e-consultations or e-prescriptions, etc. in Germany, I think if you compare that, for example, to the US, I think we're probably living a couple of centuries behind, right? I mean, to me, what I can see currently, I think there's a big push currently, obviously, by all stakeholders to have further digital health solutions being not only being used, but also being reimbursed. We need to see, but that's also maybe the kind of big opportunity, whether that would still be allowed in the way as it is now after the crisis. I have my hopes. I would probably even bet on that, because I think once something is being used, once physicians, patients, different stakeholders are using it, I think it will probably not go away. And just to add maybe here as well, I mean, the whole kind of digitalization is probably seeing a big push now in Germany. So I think because of the overall push on digitalization, I think that might also have a bigger kind of push on the digital health, let's say, agenda in Germany as well.
Okay, thank you. I don't see any other question. Oh, now here's one coming. A quick question. Is it possible to conduct those simulations for products which enable earlier, I think that means testing at the end, yes. Is it possible to conduct those simulations for products which enable earlier testing? So if we have like a quick test coming up on the market, can we then adapt the model?
Yeah, I mean, I guess earlier testing is probably two different things, or it might potentially mean two different things, right? I think one is maybe testing for immunity in the population, but I think what the question may be more raising for is maybe a faster, more kind of rapid test, right? Especially
yeah, he means diagnostics. Just
yes, exactly. I mean, especially now if we see that patients might need to wait, let's say, on average 2 to 3 days before they have their PCR results from the physicians. I think those kind of tests would obviously have a very impactful and valuable kind of opportunity in the system. We haven't done those kind of simulations yet, but it is doable. I think we have currently tried to do those scenarios which we currently see and the discussion we currently have. I think the vaccination is a very valid one since yesterday, but I think also, and especially if we look over, for example, to the US as well, or to some of the other diagnostic companies, maybe as well, located in Switzerland, I think there are a couple of rapid tests probably approaching the market quite soon. And I think then such an analysis might be very valuable, especially if we want to see then the impact on the infections, the hospitalizations, the ICU beds as well. And then finally, obviously also the cost for the healthcare system, because ultimately we have seen in Germany, I think the estimation for the cost might be around €1 trillion. So any kind of, I guess, cost savings overall might be seen as worthwhile for the system.
Okay, thank you. And another question about the model itself. It's maybe also something for our mathematician, our good friend, Dr. Schwem, who developed the model. Would the system allow prediction for a second wave of infection?
Absolutely, and we have tried already some of those scenarios. One opportunity, for example, in the model is that you, let's say, put in an alert, for example, which might as well be now effective in the system itself. Whenever there's a threshold, for example, of the number of ICU or also normal wards, so normal ward beds, basically, which might be reached, then that another kind of lockdown might be utilized, for example. In that way, you could basically bring the infection rates again down. So you could even have, for example, not only second, but also third or fourth wave, especially if there might not be additional kind of drugs or vaccinations or any other kind of solutions being available soon in the future.
Thank you. Okay, I think we're done for today. If you like this webinars, please join us at some other webinar. If you have any wish we could have or use here as the next topic for the webinar, please send the email to Stefan. You already got his email with the invitation of tonight's webinar. And stay healthy and good luck with this COVID-19 disease. And thank you, Stefan, for this wonderful webinar.
Thank you for attending. Thank you, Lutz. Have a good evening, good rest of the day, and see you, some of you maybe as well soon. Thank you. Bye-bye.